Hi there, welcome back to the channel. Today we're going to talk about something I know you have questions about because people ask me this every single day, and that's what over-the-counter medications are safe to take in pregnancy. So let's go through these category by category and talk about what might be right to you, and some of the answers might surprise you. Before we get rolling on this, let me tell you a few basic caveats. The first is always check with your provider before taking any medications, because even though we know in general terms what's safe and what's not, everybody's a little bit different, and every provider has their own experience and their own advice for you. So check with them before you take any advice away from this video. The second is avoid anything that you can avoid taking in the first trimester. Even relatively safe medications can cause problems during this very early and very fragile stage of fetal development. The next thing is don't take medicines in combinations. Sometimes things are safe if you take them individually, but they might interact with each other, or they might contain some of the same ingredient, and you don't want to get too much of any one thing. Next, try non-medication options before you switch to medication. It might be something that you could do with your diet that might reduce your heartburn. There might be something that you can do to relieve your anxiety in terms of lifestyle modifications. So try those things, some local heat for your back pain or a maternity belt perhaps, before you jump onto medications. Medications don't fix everything. And lastly, before you get started, remember that not every medication is for everybody. So even if we tell you that, for instance, decongestants are safe to take in pregnancy, that's not always true if you have an allergy or if you have high blood pressure. So remember that this is a very high level view, and always check with your provider before you get started. I live in Texas. We have a lot of seasonal allergies here, and people get coughs and colds in the summer and the winter months. So let's talk about cold and allergy medicines first. Antihistamines, in general, these are considered safe. So things like Benadryl, Claritin, Zyrtec, Allegra, all of these are usually pretty safe in pregnancy. So if you're really drippy or you have itchy, watery eyes, these are going to take care of you. Decongestants are a different kind of medicines, and many times they're in combinations. So medicines like Dayquil and NyQuil and Tylenol cold and sinus, these are combinations of antihistamines and decongestants, but you don't necessarily need both. So if you're just really stuffy, then a decongestant might be what you need. So there are medicines like Sudafed or pseudoephedrine that can help shrink down these nasal mucous membranes and help you breathe through your nose again, which it can sometimes be kind of hard to do in pregnancy. Next, let's talk about nasal sprays. So if it's just your nose that's really stuffy, that's not surprising because that happens in pregnancy. All of your mucous membranes swell, so a lot of people keep a little bit of a stuffy nose all through the pregnancy. So nasal sprays are okay to take within certain limits. So saline sprays are always going to be safe for you in pregnancy, and that helps clear out a lot of the thick secretions that might help you blow your nose and actually get some results. The next thing is medicines like nasal steroids. This is Flonase, Nasal-Quart, Nasonex, medicines like that. In general, those are very safe in pregnancy because the steroid that's in them doesn't circulate much around your body. Mostly it stays put right in your nose where you need it. So if you're having trouble breathing through your nose at night, or if you're having trouble with seasonal allergies, this might be just the right thing for you. Cough medicines. So there are medicines like Robitussin and Mucinex, and the plain Robitussin and Mucinex contain nothing but an expectorant. That loosens your secretion so that your cough will become looser and it'll be easier to get things up and out. There are other varieties of these medicines like Robitussin DM or Robitussin PE that contain additional ingredients. So make sure that you check the label and just take what you need. All right, next, if you have pain, and probably you will have a headache at some point in the pregnancy, or your back is going to hurt. So if you need to take something for pain, medicines like Tylenol or acetaminophen are your safest bet. Almost everybody tolerates that well, and it tends to work pretty well. Remember that you can't take nonsteroidal anti-inflammatory drugs in pregnancy. So medicines like Advil and Aleve, we talk about this in another episode, but avoid those in pregnancy. If you have a history of migraines or severe pain, you might need something stronger for your pain. And ironically, talk with your doctor about prescribing a medicine that has Tylenol and maybe an opioid or narcotic in it, because Tylenol with codeine, ironically, is safer to take in pregnancy for most people than taking an Advil. Next up, constipation. Almost every single pregnant person gets constipated at one point or another during the pregnancy, and some people just stay that way. So I recommend that almost everybody take a stool softener. In addition to adding fiber and lots of fluids in your diet, stool softeners like Colace, Fibercon, Citracel, Metamucil, all of those things have psyllium in them. Most of those things have just tree bark, and they help draw more water into the gut and help your bowel movements stay softer so that you don't have to push or strain, because that makes hemorrhoids worse. The next thing is laxatives. If you are really constipated, a stool softener might take a few days before you really see results from it. So every now and then, if you need to take a laxative, go ahead. Medicines like Senokot, Dulcolax, Miralax, those are all okay to take in limited quantities every now and then. And what if you have the opposite problem? If you have diarrhea, and people can get that occasionally too from something that you ate or stress or for whatever reason, Imodium is usually considered safe to take in pregnancy. But equally important, if you have diarrhea, you're losing a lot of fluids, so you've got to work hard to replace those fluids. So every time you have an episode of diarrhea, you should probably drink a liter of fluids. Another common problem is hemorrhoids. Hemorrhoids are just varicose veins that occur in the rectal area. And if you're pushing and straining for bowel movements, these are going to get worse, or they're going to pop up where you didn't have them before. So first, address the underlying issue, which is usually constipation. But when you have occasional hemorrhoid flare-ups, try things like Preparation H or witch hazel preparations like Tux. There's also a medicine called Anusol, and now they make Anusol HC, which has hydrocortisone in it, and that has steroids in it that help shrink down swollen, painful hemorrhoids. So you can use these things pretty safely in pregnancy. Most people have some degree of nausea, mostly at the beginning of pregnancy, but every now and then something might just strike you wrong and you want something that you're able to take for nausea. You can try some non-medication remedies like ginger root. Vitamin B6 is usually very good for nausea. In fact, B6 is in one of the most commonly prescribed nausea medications that we use in pregnancy, and that's a diclegis. So that's just vitamin B6 and an antihistamine. Other nausea medications that can be taken in pregnancy are things like Phenergan, also called promethazine, and there's a medication called Zofran or ondansetron that we use pretty commonly in pregnancy too. Only take these as long as you need to. A little later in pregnancy, you might suffer from heartburn or acid reflux, and there are medications that are perfectly safe to take for that. Start with antacids. So these are Tums, Maalox, Mylanta, Gaviscon, Rolaids, all these antacids. Some of them are aluminum-based, some of them are magnesium-based. Check with your provider to see what she prefers. The next step to try if antacids aren't taking care of your heartburn would be things like Pepcid and Zantac. These are called H2 blockers, and they usually will work well if you take them in addition to your antacids. And the last thing, for acid reflux, there are medicines that are available over the counter now called proton pump inhibitors. So this is your Prilosec and Prevacid, Nexium. Medications like that can actually stop or greatly reduce stomach acid production so that your acid reflux gets so much better. Sometimes in pregnancy, when you think you're nauseated, what you really have is acid reflux. So Nexium can work better than nausea medicines later in pregnancy. Okay, for insect repellents, things like off that have DEET in them are safe to use in pregnancy, and it's actually much safer to use an insect repellent than it is to get bitten by a mosquito here in Fort Worth, where we have West Nile virus, Zika virus. All of these things are mosquito-borne illnesses, so protect yourself whenever you're going to be outdoors in the heat. And the last thing that people ask about is, what can I take to help me sleep at night? As you get further into the pregnancy, just staying asleep can be a real challenge. You need 10 pillows in the bed, you roll this way and that and tuck pillows everywhere. And then by the time you get comfortable enough to sleep, you have to go to the bathroom. So you have to get up and get back in bed, and it starts all over again. So for sleep, you can take things like Benadryl or Unisom. Those are antihistamines that will make you drowsy. So you don't necessarily want to take those as an antihistamine during the day. Stick with Claritin or Zyrtec. But at night, when you want to be sleepy, those may be just the right medicines for you. You can also take ZzzQuil, Tylenol PM, which is Tylenol if you have a back pain and you're not able to sleep. That might be a great option for you. And melatonin in low doses is perfectly fine to continue in pregnancy. And there are some studies that even show that it might reduce the risk of complications around the time of birth. So that's the general overview of medicines that we think are safe to take in pregnancy. But remember, check with your provider before you start anything. Avoid medications in the first trimester whenever you can. Don't mix medications before you check with your provider, and also read the labels for medications. And try some non-medication options before you jump to medication, because sometimes those will do the trick. Thanks for watching. As always, see you next week.